Welcome to the deep dive. Let's jump right in today. We're looking at a really significant recent interview.
Yeah, the one with HHS Secretary Robert F. Kennedy Jr. on CNN. It came right after his department dropped a major new report.
Exactly. And for this deep dive, we've really dug into the key bits of that CNN transcript.
And also the follow-up commentary from Dr. Sanjay Gupta, who was actually doing the interviewing.
It covered so much ground, didn't it? I mean, everything from chronic disease, which is huge.
Huge. And environmental toxins, food, farming.
Even getting into government accountability, trust in, official advice. A lot.
So our mission here is really to walk you through this pretty dense conversation. We want to pull out the main insights.
Maybe some surprising details, too.
Definitely. And the points where there was disagreement or tension. The goal is for you to quickly grasp the core issues and, well, what's at stake.
Okay, let's unpack this then.
So the big thing right at the start was this new HHS report. The secretary called it a diagnostic exercise.
And the target, this crisis of chronic disease, especially hitting kids hard.
Yeah, and the report points fingers directly at, well, a few key things as the stated causes.
Like ultra-processed foods, that's a big one. Chemical exposures.
Lack of physical activity, stress, chronic stress, and even the overuse of prescription meds.
He seemed to think this report was a pretty big deal historically.
He really did. Framed it as the very first time all the federal agencies have officially recognized this specific crisis together.
Said that previous directives, even under Biden, hadn't used the term chronic disease.
Right. And he brought in that historical context, linking it to his uncle's efforts back in, 1962.
Yeah, after Rachel Carson's book Silent Spring apparently kicked things off.
So important to remember, this report is the diagnosis. It's laying out the problem.
The prescription, the actual policies, that comes later.
Yeah, he said roughly 60 days for those recommendations.
But some things are happening now, he suggested.
He did. Mentioned getting rid of certain food dyes, for one.
And tweaking the SNFP program, so you couldn't buy sodas and candy with the benefit.
Exactly. And also reviewing the official dietary guidelines. Those are due in August.
He wasn't exactly complimentary about the last set of guidelines, was he?
No, he was pretty critical. Said the 453-page document was too influenced by industry.
The Fruit Loops comparison.
Yeah, like Fruit Loops ending up high on the food pyramid was his analogy.
Also mentioned looking at GRAS standards generally recognized as safe.
Right, and made that pretty bold claim, that they've done more in 100 days than predecessors did in decades on these root causes.
So wrapping up this first part, the message is, this is supposed to be a big, coordinated government effort to really figure out why we have this chronic illness epidemic, particularly in kids.
And that leads right into the environmental piece because the report connects that too.
Right, the toxins and microplastics.
Right.
It says kids are exposed to harmful levels.
But this is where the interview got a bit tense.
The EPA question. How does this report warning about toxins fit with other reports saying the EPA might be weakening rules on things like
Forever chemicals,
Yeah.
PFAS in drinking water.
And his response.
He flat out said those reports of rollbacks are not true,
Based on what?
based on apparently a chat with Lee Zeldin, who's on his commission.
Okay. And then there was that mention of beef.
Yes, that was definitely a notable detail. He said tackling beef is a priority for HHS and USDA.
Priority how?
Said they want to limit its, quote, proliferation in the environment and its use in manufacturing.
Use in manufacturing. What does that mean exactly?
Honestly, the transcript wasn't super clear on that specific point, but he flagged it alongside environmental concerns.
And how did he explain the perception of weakening environmental rules while raising alarms about toxins?
He framed it as balancing economy and health. So any rollbacks orchestrated by Zeldin are designed to restart and assure policy.
And connected it to the pandemic.
Yeah, saying they learned economic prosperity is a key social determinant of health.
So you've got the report saying one thing about toxins and the administration explaining regulatory moves differently, a real point of tension.
Definitely highlights the complexities.
Let's bring it back to the grocery aisle for a second. What about, the single mom or any family on a tight budget where processed food just seems like the only affordable option?
He tackled that head on, argued that it's not really cheap food.
How so?
Because the real cost shows up later. Expensive health problems, diabetes, autoimmune issues, this mitochondrial dysfunction.
Which is about cell energy, right?
Basically, yeah. And inflammation. He said those are the hidden costs.
And he threw out some pretty scary stats.
Eye-watering, really. 38% of teens, diabetic or pre-diabetic, almost 4 in 10.
Said 1 in 3 kids he sees has it.
And a $1 trillion a year cost just for that mitochondrial dysfunction issue. Plus, that 75% of kids can't qualify for the military, often due to health.
Wow. He also pushed back on the idea of food deserts.
Yeah, claim there's no place in the lower 48 where you absolutely can't get good food. Acknowledged it's not always easy access, though.
Did he see any solutions beyond just saying eat better?
He pointed to market changes already happening, argued that companies, even older ones, are starting to change ingredients because consumers are demanding it.
Mentioned fast food moving off seed oils. Chobani.
Yep. And talked about an innovative tech solution.
The app.
Right, working with industry on apps, like one called Yucca, where you could scan a barcode.
And get like a red, yellow, green light.
Exactly. A quick health assessment right there in the store.
So the idea is not government mandates, but information driving market change.
He framed it very much like that. Not a nanny state, but empowering consumers with info to shift the market.
Okay, but anytime a report mentions chemicals in farming, there's going to be pushback.
Absolutely. Farmers, agricultural groups, some senators expressing concern about what this means for EPA-approved pesticides.
The interviewer brought up Kenneth Hartman Jr. from the National Corn Growers, questioning if this was just duplicating EPA work.
Yeah, and the secretary's response was basically reassurance. Said nothing in this report should worry farmers.
Claimed the critic hadn't even seen the report yet.
Right, and he really leaned into this idea of farmers as partners, not enemies.
Mentioned meeting farmers who are struggling financially.
Said 7 out of 10 lose money most years. Stressed the goal is not to hurt them, but help them stay in business.
So the proposed path forward is incentives, innovation.
Exactly. Help farmers use less chemical-intensive methods. Again, explicitly rejected coercion or a nanny state approach.
Trying to position farmers as allies.
Very much so. Call them original environmentalists who want to produce healthy food but need the right support, economic, technological.
What about his past comments? Some interpreted them as wanting to, weaponize agencies against chemical ag.
He tied that back to the processed food issue and those diabetes stats we mentioned. Framed it as using science to target things he sees as driving a health crisis.
Okay, let's shift gears to something very specific that caused a stir. Milwaukee.
Yes, the lead crisis there. He had claimed on Capitol Hill that his team was on the ground helping.
But the city and Senator Baldwin said, nope, not true.
Pretty much. Said they weren't getting the requested CDC help.
How did he respond when pressed on that in the interview?
He doubled down, insisted we are there. But interestingly, couldn't say how many people.
Offered to check.
Offered to check, yeah. And added he wasn't necessarily believing Senator Baldwin.
And this is where Dr. Gupta's follow-up was key.
Very key. Gupta basically confirmed the city's version based on his own reporting.
Compared it to Flint, where the CDC response was apparently much bigger.
Much more robust, yeah. Testing centers, epidemiologists, a whole registry. Said that wasn't happening in Milwaukee.
Gupta detailed the city's timeline of calls for help being unmet.
Right. Called in March, told in April deployment wasn't happening, experts unavailable. And the Milwaukee Health Department put out a statement calling the secretary's claim inaccurate. No federal EPI-support.
What about the claim that one person was there?
Gupta clarified that. Said one CDC person was there, but for general work scheduled before the school crisis blew up, not part of a dedicated crisis team like Flint had.
So a real disconnect between the secretary's statements, even his stated passion for the lead issue, and what seems to be happening or not happening on the ground.
It really highlights the difficulty in verifying claims about resource deployment, even from the top.
Another area where things seemed fluid, let's say, was the timeline for figuring out the cause of autism.
Right. The interviewer brought up his earlier statement about knowing the cause of the autism epidemic by September.
But the timeline shifted in the interview.
It became more nuanced. Dietary guidelines in August, second stage of the report in August, and by September, they'd have some studies done.
Specifically replication studies.
Yes, he emphasized that. Replicating existing research to ensure findings are solid. Mentioned NIH funding changes to support replication, prevent cheating. Said 15 groups were getting grants for this work very soon.
But a definitive answer on the cause, not September.
No. He clarified that getting solid information on the etiology, the cause, would likely take another 6 months after September.
So pushing it to maybe March next year?
Roughly, yeah.
And what did Gupta make of these timelines?
His commentary suggested both September and March seemed unrealistic.
Based on...
Based on decades of prior research, complex studies like vaccinated versus unvaccinated cohorts, it just takes time.
So Gupta thought September might just be about figuring out what studies are needed.
Kind of laying the groundwork, yeah,
Yeah.
not providing actual answers. Experts view these timelines as extremely ambitious for such a complex issue.
Which brings us to maybe the most talked about moment of the interview.
I think so. When the secretary said people should not take medical advice from him, the HHS secretary.
Why did he say that? What was the reasoning?
His point was, historically, most HHS secretaries aren't doctors. The official public health advice comes from the ACIP.
The Advisory Committee on Immunization Practices.
Right. A group of scientists looking at data, not the political appointee secretary.
And he made that distinction between trust the experts and trust the science.
A very sharp distinction, called trust the experts, especially during COVID, a bad message.
Associate it with religion, totalitarianism.
Yeah, his words. Said it wasn't democratic. Instead, people should trust the science, meaning replicable, gold standard research.
You do what with?
To allow people, like parents, to make their own choices informed by that science.
So his message was basically, be skeptical, even of official advice.
Pretty much. Be skeptical of authority, do your own research. He used that analogy of moms researching baby products. Apply that same critical lens to health info.
And his reason for that skepticism? Bias.
Said experts, agencies, the media, they all have biases. Claimed the responsibility in a democracy is to think critically, make up your own mind. Felt that was shut down during COVID, with media complicity.
How did Gupta react to that specific point?
He acknowledged most secretaries aren't doctors, but pushed back slightly. Said the HHS secretary is the CEO of this massive health enterprise.
So their words do matter, regardless of an MD.
Exactly. They carry weight, influence policy.
Yeah.
Gupta saw the secretary trying to draw a line between his personal health views and his official role.
Okay, so that really brings our deep dive into this whole conversation to a close.
Yeah, we've covered a lot of ground.
By looking closely at the transcript, the commentary, you really get a feel for the scope, the big plans on chronic disease, the environmental regulation tangles.
The whole debate around food costs and access, how to work with farmers, those specific factual disputes like Milwaukee.
The shifting timeline on something complex like autism causes, and yeah, that really provocative take on trust and expertise. It's way more than a headline deep.
And what's really fascinating, I think, is this vision the secretary is putting forward. A future where it's all about individual empowerment through information.
Like scanning food barcodes or deciding for yourself if you trust medical advice based on your own research.
It's a fundamental shift in where the responsibility lies, potentially.
Which leaves us, and you listening, with a pretty big question to chew on.
In this current environment where you have conflicting information, disputed facts, questions about expertise, how do you navigate that? How do you decide who and what to trust when making really important decisions about your health or your family's health or even your community's health?